So, in talking about chest images in children, these are the areas we're going to look at. First of all, we have to look at all the elements in the chest: the lungs, the heart, the airway, the pleura, the soft tissues, the bones, upper abdomen. We all know this. This is not news. It's always a good idea to look at the whole picture before you delve into detail, because sometimes people are so involved in looking for something specific that they forget, they don't see the wood for the trees. So we'll talk about that, show some examples. In children in particular, we have to be able to recognize what's normal versus what's actually abnormal. Symmetry is really important. The chest, we have two lungs and two chest walls. Unfortunately, not two hearts, but so we have the ability to look at symmetry. The airway is important. In fact, somebody once told me the definition of a pediatric radiologist is they look at the airway. But looking at the airway specifically is very important. Air leak has already been discussed, but we have a little quick look at that. And then we'll talk about some more focal abnormality, some diffuse abnormality, an underlying lesion with a secondary abnormality, and then some incidental findings. So when we're talking about the whole picture, this is a 4-year-old with shortness of breath. And you can see that there's sternotomy wires and some cardiomegaly, but the lungs look pretty good. And yes, next case. But, oh, wait a minute. If we look more carefully at everything, we see that, in fact, there's a very abnormal arm. The whole humerus is at least turned and partially missing. The scapula is abnormal, and most of even the lower arm is missing. And so this helps us diagnostically because it suggests that the underlying cardiac lesion is part of something called the Holt-Oram syndrome. And this child had both an ASD and tetralogy of Fallot, as well as absence of some of the musculature and this abnormally formed arm. Again, looking at the whole picture, in both of these two different patients, we see in one of them that the ribs are extremely thin compared to what the ribs normally look like. And in the other, we see that the anterior ribs are kind of verticalized instead of being horizontal. That's suggesting that there's a somewhat weak chest wall, that there's something wrong neuromuscular. And also there's some radiculobatolactasis there. On the left is a child with myotonia dystrophica, and on the right is a child with muscular dystrophy. Again, also in this child with muscular dystrophy, you can see that the long bones are very thin and gracile as well.